empowering voices in healthcare innovation.
Ladies and gentlemen, thank you so much for joining us today. Our panelists are each decorated in their fields and have taken the time out of their busy schedules to benefit all of us today. We've taken the liberty of taking a predetermined poll across Malta, across Europe, and across our borders to find some of the most beneficial questions to present to you today, while keeping the patient at heart, of course. So we only have 30 minutes so we're gonna have to dive right into it, ladies. Let's give them all a round of applause to start with, guys. So my first question is to Marina Al-Khwand. Marina, you're the founder of MedDonations and HIMSS Changemaker Awardee. The first question that has come in for you is, Marina, MedDonations has an incredible impact, especially considering the challenges that Lebanon is facing today. With MedDonations providing free medication to over 20,000 patients, could you share how your organization has adopted its medical strategies to maintain access to essential medication during turbulent times? And maybe you could touch on some of your partnerships with tech companies and how that has enabled you to keep pushing through.
Thank you, Hassan. Thanks everyone for joining. I'm really honored to be sharing this panel between esteemed colleagues, panelists, and visionaries as you. So I come here before you as the founder of MedDonations nonprofit in Lebanon, as Hassan introduced, but not only as this, but as the voice of a population and nation who is constantly facing crises. Since 2019 up until today, Lebanon is a nation in which we faced the explosion on August 4, 2020, and this is where MedDonations started our mission to give free, equal, and fair medical assistance and medications to every human being who is in need of it. Then, afterwards, we faced a total shortage of our medications, where our medical system collapsed, each after the other, from the medications to medical equipment to hospitals, clinics, and the fleet of our healthcare professionals, and some of them who died on the front lines. And now, unfortunately, where our country is facing war, and every single day we're losing lives between civilians and healthcare professionals, and we have 1.5 million individuals displaced from their own homes to other regions. So from this, MedDonations started, holding one mission and vision. But all in all, as an individual effort, we couldn't make it up until here. We saved 20,000 lives, and that's true. But every single life matters. And how we made it is through partnerships with MedTech solutions, MedTech companies, which enhanced our work on field. Because when you work in a field full of crises, challenges, and obstacles, it's not easy to be not implementing these technologies that will help you on field, maybe serve more patients, get the right tools, get the right means to help these patients in need in the right time and in the right way. Otherwise, you lose lives and not save lives. So this is where our partnerships with several companies started in 2021. Some of them called PillEye, Medality, MediSafe, teleconsultation platforms in which we were on field all over the country, giving teleconsultations and then using these technologies to implement the medical tracking and medical distribution for the patients. And currently with our partnership, the biggest partnership with IGEA company, to give the patient and to empower the individual with the right to own their own data, which is one of the core values of MedDonations as well. And to have this open infrastructure, which any company around the globe can implement in this platform, so the individual will have access to this platform, which has everything. So by that way, it's not only in Lebanon, it can be implemented all around the globe. And that's our mission, to unify our efforts using MedTech solutions to serve humanity all around, and to implement our strategies that are built on resilience, determination, humanitarian efforts, and tech efforts to more than a country.
Marina, it's very difficult to take initiative with such a subject, right? If you could just in a minute give some advice to somebody that's maybe in your shoes as well, that's still starting out, give some of the constraints and how you went around them to be where you are today, actually helping more than 20,000 patients.
You know, I started in a mission to centralize the efforts. I thought that centralizing everything in one country, since I'm operating in Lebanon, would be more beneficial and not growing into more countries and finding maybe some sort of support from the outside. But in this month especially, I learned the other way, that decentralizing our efforts will make it more sustainable, because my country now has nothing to offer. So if I was only relying on Lebanon, I would have lost it, and all patients would have died because of lack of medications. But we did the other way. We decentralized to more than 65 countries. So now we collect medications and get aid and support from doctors living in 65 countries around the globe, covering all continents. The second one is building trust with the companies you're working with, because it's very important that the patient and the healthcare provider will trust the platform you are using. Otherwise, you're gonna also not be targeting the need. And targeting the need here is the bold thing, because otherwise, you're not really answering the need of the people.
Thank you so much, Marina. Next, we're going to go to Gertrude when we're going to speak on mental health and patient empowerment. Sometimes mental health, unfortunately, not in Malta, not in Europe, but in other areas around the world, is seen as taboo, which is wrong, and we all know that in the medical community. The question that came in from the audience: you've recently completed a meaningful patient advocacy, and you've recently completed a study on meaningful patient advocacy, and you're also so deeply involved in patient empowerment and self-management. From your research, what do you believe are the most effective ways that patients can be empowered to manage their own health, especially with the rise of digital health tools?
Thank you very much. I'm honored to be here, and following Marina, I think my intervention will be a bit more grounded from a patient perspective. The word empowerment, when we wanted to translate it into Maltese, gave us a big challenge, because we couldn't find a Maltese word which could take the total significance of empowerment. So through our research, we've encountered the breakdown of empowerment given by the European Patients Forum. And I like to use this for empowerment brings together education. Education is important for prevention. It's important so the patients can manage their condition and they can access timely services. The patient experience is definitely key to success, while their expertise puts the patient on the same level as professionals. The professionals have their expertise, but the living day-to-day with a condition is definitely makes you an expert. Obviously, patients need to be engaged, and I think such a platform is very important where we have patients engaging with the future, because digital health is the future, and that makes it the patient equitable. We are equal partners in whatever the future lies ahead. So patients need to have health literacy, digital literacy, but I encountered a newly coined phrase, digital health literacy. So for patients to be truly empowered, there is a whole process, education into the digital, education into the health. Because nowadays, you can't access your health unless you are digitally literate. E-health, telemedicine, electronic patient records, apps, data health space, it's infinite. So we really need to put our brains together to get this information to the patients. So whilst we recognize the benefits of digital technology in health, without digital health literacy, we will only increase disparities and inequalities. So we need to develop equitable and impact-focused investment in high-quality inclusive digital education and training. So yes, we are at the edge of the future.
So I have a follow-up question for you, maybe to help shed some light and to give some perspective to our viewers. What do you see are some of the challenges that an organization faces when they're advocating for a patient-centric approach? What are some of the challenges that you're facing today while you're trying to push through and forward?
The big imbalance between what is available and what is accessible. And it's not because it's not accessible financially, but maybe we do not know about it. We have patients who are so advanced, they are all the time researching, that they bring themselves the information to the professionals. The health systems are not so fast at picking the pace of development. So it is very important that we pick up speed to meet, to match what is available and what is needed.
Excellent. Thank you so much. Trissa, this question is for you. We're going to be speaking about patient experience and migraine advocacy. A very niche subject, right? Your foundation has done remarkable work in raising awareness about neurological conditions like migraines, and I imagine cluster headaches as well. In your experience, what are the most impactful ways patient advocacy can improve patient experiences?
Okay, thank you very much for being here. We are not talking only about migraine, we are talking about the invisible diseases. And also, one thing that is invisible is the patient in the healthcare system. Then in our foundation, we are also working with patients to try to be more visible in our system. Then when we are talking about patient advocacy, it's not only about awareness, it's transforming the very core of healthcare innovation. And how we do this, it's by ensuring that patients' voices are not merely heard, but are, as Jedward was saying, are truly integrated in the system. Then we want to be heard, but not also heard. We want to be part of these activities. We want to be part, as you were telling, as equal partners. Then, if we are talking about this patient experience with innovation and with technology, we have to be sure that we are integrated the real voice of these patients, because we want an innovation that it's functional, that it's not only innovation and technology. We want to have a deeply human vision there with this kind of innovation. Then, if you want to assure this that we have a real human innovation and a good patient experience, you have to include the voice of the patients at every stage. And then you will meet these needs, the real needs, and then you will go to the targeting needs of the patient. And then I also, in my work, in my foundation, I often challenge developers, stakeholders, and everyone who could hear me, that if you are innovating with patients or just for the patients, then for me that's the key. If you are innovating with patients, you will go in the right direction. If you are innovation for patients, let me say that you are not in the good way.
So maybe a good follow-up question. Could you give us, from your experience and what you've been through, some of the feedback that you've received from patients specifically with chronic neurological conditions, and how that's helped shape your journey and where you're going from today to the future?
Well, I think the problem here is when we talk with patients, I told, but I could say that I'm a patient, but I'm very empowered. then probably when I'm talking to another patients that they are just starting with this kind of work, they think that they are just a checkbox. Okay, they are not really integrated in the system. Then, if you want to change this, you need to have the real willingness of involving patients. Then you will have a good way to improve. And for me, the way is to create patient-led advisory councils, but real patient councils. Because sometimes it's just a chat box. They don't have the ability to take decisions or really be part of this. Then I think if you do these two things, probably it's just the way to start to be really impact.
Excellent. Thank you so much. Michelle, just like everyone here, it seems to me that you're always trying to shine a light on those that need that light shone upon them, right? And you've been a rare disease advocate in small nations that need that voice. So the question that has come in from the audience, when you have been a champion for rare disease patients in Malta through leadership with the National Alliance for Rare Diseases, what are the unique challenges of advocating for rare disease patients in small countries like Malta and beyond? And how can Malta, as a member of EuroDIS, and Rare Diseases International, contribute to the global conversation about rare diseases?
So thank you very much for inviting me here. This is actually a very good platform for us, especially being a small NGO in our country where we are advocating for persons, I must say, not people, not patients, but persons who are living with something rare. Now, we are a country with 500,000 population. It's a very small country, but I must say, where rare diseases are concerned, we have something out of everything that can be imagined, which would mean that you might have one person in the country suffering from that particular disease, and the next person suffering from that disease might come in 2 or 3 or 4 years' time or 10 years' time, meaning that they come few and far between, with most of the healthcare professionals most of the time don't meet anyone like that in their lifetime or in their career. So we are not just talking here about a disease or a condition that is common and that we need to talk about it to garner support. We are talking about a disease that we need to learn about in certain stages. At our foundation, at our alliance, these patients can be babies, they can be youths, they can be middle-aged persons, they can be older persons. They can be people who are verbal, they can be people who are non-verbal. So in our case, we also try and give the carers a platform, because it's sometimes, especially, we've just mentioned neurological diseases. Where neurological diseases are concerned, we have older patients that do not have a physical voice because they would be physically unable to talk or unable to move. And that is where the carers, the support system is important. So for us, in Malta, most especially where I must say, we have a very good healthcare system. In general, people feel that having a free health system where people can access treatments, medicinals, first aid help. Yes, we might have, as Gertrude said, a disparity sometimes between knowing what to access and knowing what is there and accessing them. But that is for what I have to, what I say describe as common diseases. where rare diseases and conditions are concerned, we still face a lot of inequalities, we still face a lot of inequities, not just for the patients themselves as patients, but also for the carers, for the support system. So we are on the platform of Eurordis and Rare Diseases International. Right now, as Eurordis, we are trying to get everybody on board, especially our country, and we're at home, so maybe we get heard. It's very important that Malta starts working and being really practical on creating a national plan for rare diseases based on a European plan. Of course, then this European plan, together with our European counterparts, we're trying to push it into the European platform. So I'm looking forward, together with my colleagues, to be heard by the new health commissioner in the EU. So we look forward to that. And on an international sphere, we are very happy to have had the resolution at United Nations level being passed, but now it's very important that we see through the WHO resolution, which maybe through those platforms, it can fizzle down to coming here, even on small island states like ours, where maybe we're very small, but we're very good, as I said, in healthcare, but then maybe we're taken for granted as well. Because in the general system might be good, but when we identify diseases, when we identify conditions, when we identify patients, I don't think we are there exactly where we want to be.
So, Michelle, a follow-up question, please. And I know that you have a plethora of stories. If you don't mind, please, in less than a minute, would you share with us one successful story from your experience where you've changed the system a little bit? Would that be possible? Without naming names, of course.
Yes, so we treat our patients as, of course, individuals, as I just said. And not everyone's journey is the same, especially when we try and I think there's also a bit of luck involved. For example, recently we had we were very happy to help one of our patients access a clinical trial in China. This was a young boy. He was 18. There was a clinical trial happening for his condition, and we managed to access that clinical trial through the help of different networks, especially the embassies. So we try and get everybody on board, and that's where our advocacy works. Sometimes people do other things. They do culture, they do arts, they do business, they do economics. We try to do this little thing for that patient. So I think it's an amazing thing. This person is, of course, still going through the treatment. It's ongoing. We'll see results maybe in the coming months, hopefully. But even just for the sake of that person knowing that he did what he could do, and pushing the boundaries and going across countries and getting everybody involved, at least deep down, you know that you did what you had to do.
Thank you so much, Michelle. So maybe a closing question, and we'll start from this side. If you guys don't mind, in just 30 seconds or less. After listening to you guys, we're going to put the note cards away. Do KPIs matter? Are KPIs of the uppermost importance when it comes to our subject at hand? Yes or no?
No.
And why?
Every single life matters. If we were able to save one life, then we had it all. We're saving the mission.
KPI matters if they give the desired results, because then it's a jungle. And what I mean is that if following a protocol leads to at least one person getting what they need, they're worth it.
And that's a different measurement then, which is great. Patricia.
Yeah, I'm totally agree. It's yes, KPIs matters, but if it's targeting a real need, and then if the KPI, it's use it with the voice of the patient, because it's not the KPI that the persons of the leadership are putting. No, it's the KPIs that matters the patients. Then with these KPIs, yes.
Michelle, we're going to conclude with you, and I know you have something to say
I am
about this.
always a renegade, and I don't really believe in one size fits all. So yes, of course, that's the system, you need them. But in our case, where we are advocating, we need to go more into individual, and we need to see that behind everything there is a person, there is a family, there is somebody who's living, and we need to also be truly patient-based. So yes, I think it's everything is important, and then you have different channels, and those different channels will work on their priorities.
KPIs, key patient interventions.
Excellent.
Yeah, it's
Nice.
it's about the ROI. It's social ROI. Then you have to change the questions that you are putting for the KPI.
How to identify it eventually.
Yes. We need to keep pushing, because if we feel comfortable because some things are in the system, that means then we're happy with them. But not everything is in the system. Life is dynamic, things crop up, things change, and that's where our innovation, and I'm very happy to be here. And yes, we have here today and tomorrow, so we're going to be pestering some people. Maybe they can join our cause, maybe they can think out of the box, they can see things that might make a difference for them, because having a rare disease or a condition comes with no plans. You wouldn't even know that you have that, and sometimes diagnosis takes long and long. You have to live with that period where also you don't know where you're channeling yourself through. So yes, you have to be a bit of a tough cookie and wander unnavigated waters.
Thank you, Michelle. Ladies and gentlemen, given their experience, we can go on for hours speaking on these subjects, but unfortunately, we've run out of time. So I'm going to ask you guys to give them a round of applause, and thank you so much for attending.